Thanks everyone for coming. I'm Lindsay Delorier. I'm the State Director of Main Street Alliance in Vermont. And I am so happy to be here today and so excited and honored. It is not every day that you get to announce a new initiative to make Vermont a healthier and more affordable place to live. And that's what we're here to do today. We are asking today the legislature to consider expanding Vermont's existing and successful Dr. Dynasaur health insurance program for children to include all Vermonters up to age 26, regardless of income. You can crunch the numbers looking at this chart next to me. You can also see the savings that we anticipate would result if we're successful in moving forward with Dr. Dynasaur 2.0. And the costs are going up. If we do nothing, by 2025, it's estimated that premiums for a platinum family plan in the healthcare exchange will cost a Vermont family $41,000. This isn't sustainable. And frankly, it's a step back for Vermont. And it's a step back we can't afford to take. That's why we're proposing this plan, to ensure that all young Vermonters from birth through age 26 have affordable health care. To lower the cost of health care for Vermont families, and to lower the cost of health insurance for employers who are providing family benefits to their employees. And for those small employers, many of whom we work with at Main Street Alliance, who can't provide health insurance to their employees, not because they don't want to, not because it's a matter of being a good or a bad employer, but because the cost of health insurance is prohibitive. For those employers and their employees, this plan will cover a significant portion of the workforce, everyone up to their 27th birthday. Young people, college graduates, you love Vermont. You want to stay here, but can you afford the cost of living? Can you afford to raise your family in Vermont? If Dr. Dynasaur 2.0 is successful, we will lower the cost of living in Vermont. So, for all these reasons, today, we are announcing our request to the legislature to study the expansion of Vermont's existing and successful Dr. Dynasaur health insurance program for children to include all Vermonters from birth through age 26.
What excited me the most was the fact that we were building on one of the most successful programs that this state has ever adopted. The legislature 26 years ago, working with Governor, recognized that we needed to ensure public health for our children. And they recognized that many kids in the state of Vermont were not getting health coverage. And so we took an initiative and we adopted Dr. Dynasaur, and it has been incredibly successful and has improved the public health of Vermont's children while being affordable. Well, we can do better than that. We know that we can expand this program to all Vermonters under 26, and we can make it even better for young Vermonters in this state. The idea of a system where we can improve public health for those who are under 26, where we can make it easier for employers, where we can make Vermont an even more attractive place for young people so that they don't have to worry about health care coverage when they are under 26. Those are all goals that we should all share as Vermonters. This study is important because what it's going to ask is this achievable? Can we put together a system that is less expensive than the one that we have now and works better than the one we have now? That is a question that we have to ask. It is a question that we will ask, and I look forward to putting something on the governor's desk by the end of this legislative session that moves us forward to ensuring that all Vermonters under 26 have health care coverage no matter their income, no matter their status.
From my own experience, when I was younger, as well as my experience owning several different restaurants, I can tell you that there are a number of younger people employed in the service sector and the food and beverage industry, and they don't have insurance, and they are going to work, and they're making your coffee in the morning, and they're serving your food when you're at a restaurant. They're there sick, and they don't want to be. We don't want them there. You don't want them there. But they have no choice because they need to work in order to afford the bills that they do have. You know, the simple ramifications of having quality coverage for young people is, to me, it's pretty apparent.